Arkansas has removed thousands of individuals from its Medicaid program for failing to comply with work requirements, a first in the 53-year history of the federal health insurance program for the poor. More than 4,300 Medicaid recipients in Arkansas have lost coverage after failing to meet the state's new work requirements, which were approved by the Trump administration and took effect in June. Personal responsibility is important. We will continue to do everything we can to ensure those who qualify for the program keep their coverage. But it is equally important that we make sure those who no longer qualify are removed, said Arkansas Governor Asa Hutchinson. A total of 4,353 individuals have been booted from the program for not reporting to the state how they're meeting the requirements or for not working enough hours. Under the new program, those who are out of compliance 3 months in 1 year become ineligible for coverage the remainder of the year. The state's Department of Human Services said it's conducted outreach from April through August to let beneficiaries know about the new requirements. But some simply chose not to comply. Those are the ones who will lose their Arkansas work coverage for the remainder of 2018, Hutchinson said. According to the number provided by the state, only 1,218 beneficiaries subject to the requirements worked 80 hours and reported that to the state in August. Another 16,357 people didn't meet the requirements last month, meaning more people could lose their coverage in the coming months. Opponents of work requirements have long said that people would lose coverage not because they weren't working, but because they weren't reporting to the state. A total of 40,190 people were exempt from reporting because they were already meeting the requirement, had a dependent child in the home, were pregnant, medically frail, or other reasons. In Arkansas, the work requirements only apply to Medicaid beneficiaries between the ages of 19 and 49 who gained coverage through Obamacare's Medicaid expansion. The Arkansas Work Program is the subject of a lawsuit filed by health care advocates in D.C. The National Health Law Program filed a lawsuit in August against the administration for approving the program, alleging that work requirements violate federal law and will gravely harm thousands of Arkansans. The same group won a lawsuit against the administration by approving work requirements in Kentucky, halting the program there earlier this summer. The judge who ruled against the administration in the Kentucky lawsuit will also oversee the case involving Arkansas. So, someone who's not from Arkansas will say, what does that have to do with me? Well, you heard this story about 4,000 people being removed because of not reporting, and over 1,000 being confirmed to have worked and being removed from the program. That's significant because you have a lot of people who call themselves trying to blame welfare and other social programs for the decline in people being able to be stable and actually do something on their own as the reason for why you have all of this poverty and just individuals who abuse the system. But we're talking about over 1,000 people being confirmed to have worked and still having their coverage taken away. So it's really a damned if you do, damned if you don't scenario that a lot of people don't want to admit they're basically consenting to. But more importantly, you read the line about 16,000 people not meeting the requirement, which means this number could go even higher. And you heard at the end about Kentucky, which means this could be coming to somewhere else. So it's really a matter of noticing something of importance, which this is the first time ever that Medicaid has just been yanked from a group of people since its implementation during the administration of President Johnson. And people still will not care. I've talked about going around and describing the $717 billion military spending bill, and these are stories that whether you like what's being done or not, they're purposely not being talked about because the people who are doing these things know they're not popular. Go around and brag about, oh man, we just took away 4,000 people's Medicaid, and we're going to do it for even more people that didn't meet the qualifications. No one would think that's good. At least most people wouldn't. So it's really a running theme. But as I've mentioned before, the U.S. is burning. You have over 70% of Americans living paycheck to paycheck, 43% of the homeless having jobs and still having no house. You have 63% of the of all Americans not being able to afford $1,000 emergency. 30 million people have no health insurance, and this is continuing that trend. So it's a cycle that plays into a larger narrative, which is the thing in Arkansas is horrible, but it's important to recognize that the significance. This is the first time it's ever happened, and that it has shown potential to spread more and more places. See, when you ignore stories like this, a lot of people who go on YouTube and shake their heads to music and other things, you effectively are allowing a group of people to get away with screwing over another group of people, um, for the sole reason that they're not you. I guarantee the people who, the 4,000 of them that had their coverage removed, they probably didn't watch and keep up with this stuff night after night. And they're having to reap the consequences, not because they're lazy or they're dumb. They just don't take the time to go and learn about this stuff. And there's a problem with that is not going and bashing the person who's, now having to pay the consequences of having a faulty right-wing takeover of healthcare, which Obamacare in of itself was, but now we're getting something even further right, where it's just taking away everything altogether. This deregulate, remove, get rid of, regressive nonsense that has really been more and more prevalent as we've watched people ignore the fact that we have serious problems in the U.S. having to do with just people in masses and completely overlooking them. So I could talk longer, but what's the point? I described earlier, I've been spending the last 6 weeks on Twitter reporting the same story over and over, and that thing barely has gotten over a couple hundred views. So with this, I'll probably go and spread it around on there too. Try to tell you why it's significant, why you should pay attention to it. But look, if you choose to ignore it, hey, it's fine. These things have a way of catching up with us. I don't want to live in a world where I say, oh, I don't care about the people in Arkansas because they live in a red state, and then you wake up 2-3 years later after the next gubernatorial election and you read a newspaper, Medicaid depletion coming to a state near you. So it's just a thing of being able to empathize, and also recognize that when there is a group of people who have been systematically, I want you to think about this. These people who, at least 1,000 of them that were on the program, that were confirmed to be working and while on the program, are literally getting punished as they are doing what is considered the right thing. They're going to work and being productive members of society, working these crummy jobs. But still, I'm not knocking what they do, but the government is. It's saying, hey, I don't care that you're actually going out and trying to do something that puts in more income so you can get on your feet. We don't care. We're just going to yank you from the program. And that's why when you talk about the for-profit system, where people get benefit from screwing each other over when it comes to their health insurance, no one wants to hear about Medicare for all. No one wants to hear about the idea of just getting rid of any corporate influence. It's just this insane socialist idea. So we can keep going down that road, and people wonder why I have lost faith in the average political observer, because they don't take the time to read up on these stories. And I just hope that they don't lose their coverage. I hope that if they see this, they get upset, and I hope that the people, in whichever state they're in, hold their elected officials to task. Don't let them take away your health insurance over nonsense with new work regulations. What even is that? The person shows up to work 80 hours a week and then gets their stuff taken away anyway. Whereas the person who doesn't go to work, you vilify and say is lazy. And some of them probably are. But the ones who show up get punished regardless. So what kind of message is that sending? So it's probably me talking, me speaking upon deaf ears, but whatever.